States, we think of oncology in a couple different ways. One way we think of it is solid tumors. Can anyone tell me different types of solid tumor cancers? Any ideas? That's okay. Okay. So when I'm talking about a solid tumor, I'm talking about a cancer that is in an organ, like your lung. So you could have lung cancer, you could have a solid tumor there. You could have a solid tumor in your breast. That's for men or women, nor in women, but it could happen in men as well. It could happen in the prostate, which is a male organ. It could happen in the stomach. It could happen really in any organ system. Cancer is really this overgrowth of cells that are not healthy. Is everyone understanding, or do we need to do some interpretation? The way we find out a patient has a cancer could be in many different ways. One way could be the patient is having symptoms. They're having pain in a specific area, they're losing weight, they're having night sweats, they're having trouble eating. Those are some basic symptoms. And of course, not every patient that has those symptoms doesn't mean that they have cancer, but those are symptoms that can be associated with cancer. When we talk about specifically breast cancer or prostate cancer, in the United States, we focus very heavily on screening. So primary prevention, trying to find a problem before it turns into a bigger problem. So in the United States, for women, there is a test called a mammogram. It's a special imaging exam. I'm seeing some people shake their heads, but maybe you've heard of that. And that's a way of identifying a tumor in the breast that can then be treated. In men, looking for prostate cancer could be from a physical exam, and you could find that you could do a breast exam that way as well. So palpation, where you feel on different parts of the body to find something that would feel abnormal, that can be done for a prostate exam. But we can also do a blood test. And so this is important for our lab students. It's a test called a PSA. And if there are high elevations, that could be indicative of a cancer diagnosis. And there are different blood tests for different types of cancers. But again, this is just talking about the solid tumor. Okay? Okay. All right. So if we find a patient has a solid tumor, then we have to look at what can we do about that. And the best thing we could do, if it's possible, is surgically remove it, because that honestly may cure it in some ways if it hasn't spread to other areas. So surgical removal may be one option. So in the hospital, you could be caring for a patient who has had surgery to remove either the tumor and the surrounding tissue, or an entire section of a lung or an entire breast as a way of treating the cancer. If the solid tumor is more advanced, metastasis is a very big word, but that means that the cancer has gone to another site. So maybe it started in the lung, but then it went to the bone, or it went to the liver, or went to a different organ site. Then that, we can't just remove everything. So we have to give different types of treatment. And the two big things I think of when I think of treatment would be chemotherapy. So that is a drug that can be given in different ways, but most notably through the vein, through an IV into the bloodstream. But there are also chemotherapy pills that patients take, so something that you swallow. There are also injections, like into the fat pad of your abdomen or into a muscle, that could all be ways to treat cancer. The thing about chemotherapy is it just doesn't attack only the bad cells, it can attack good cells too. It's not smart enough to know the good from the bad, and so then that's why patients end up with a lot of side effects. So usually the treatment, patients will get that chemotherapy and they'll do it in different cycles. So they may get a few days of therapy and then have time for their body to recover from how poorly that makes them feel and side effects that will come from it. And then they will have another cycle of chemotherapy for a prescribed period of time. And all throughout, there will be different exams and assessments like x-rays or CT scans to look to see if there is recurrence of the tumor or spreading to help gauge how the treatment is working. Make sense? Okay. Another way of treating cancer could be through radiation. And so that could be used for types of solid tumors as well. And so that's usually where patients get a certain dose of radiation for a certain number of days, and again, evaluation to see. The problem with radiation is it can cause damage to the surrounding tissue. And so in the United States, we're getting better and better. And I bet there's technology coming along like that in India as well. Specifically, we have one type of treatment in the United States called proton beam therapy, which is very precise. So radiation can be delivered to a very exact location. It's very important, especially in caring for children, because if we give them radiation to a whole area in their chest, they have a lot of years left to live, and we don't want to have damage to the surrounding tissue. So giving very precise, focused areas of that treatment is very, very important. Okay, now I want to talk to you about what I really know so much about. So I take care of patients who have cancers of the blood. So there are so many, but we're not going to talk about all of them. We're going to talk about two main things. One is leukemia. The other one is lymphoma. So you have, obviously we've talked about many different organs in your body, but one organ that you have is something called your bone marrow. Do we have a? Okay, sorry. So in your, especially